trying to ensure that we have the treatment available for these people that at one point in their life will want to get out of the predicament they're in, because if they don't, they are going to die.
Cash Heed, former Solicitor General and Chief of Police, now a Richmond City Councillor, is proposing a supervised drug consumption site to help tackle the ongoing unregulated toxic drug crisis.
We can get them into some type of health contact, which is required, at the same time removing them from consuming their drugs in public spaces. This is a win-win not only for the addicted user who we're trying to save their lives, certainly for the communities and the taxpayers.
The motion says studies have shown that these sites can be cost-effective in the long run, reducing expenses associated with first responder response, emergency room visits, and infectious diseases. The site is proposed for the Richmond General Hospital area, aimed to be a safe and controlled environment for people to use drugs, where professionals are trained to administer overdose reversing naloxone kits. Now, we know any time a supervised drug consumption site is proposed, the idea is often met with controversy and concerns from those who live in the desired area. Part of this motion includes, quote, that staff develop a process to ensure that community concerns and perspectives are considered during the planning and implementation process.
There's a desperate need for supervised consumption services across the province. There's actually been a ministerial order in place since 2016 calling for the opening of overdose prevention sites and supervised consumption sites in anywhere there is need.
A record 2,511 people died of unregulated drug use in 2023, according to the recent BC Coroner's report. 26 of those in Richmond. Only one of those deaths occurred at a supervised consumption site, according to the coroner.
This will be one part of the puzzle that's needed to deal with the chronic and sad situation we are in.
A site in Richmond would mean less public drug consumption, less litter, less likelihood of communicable disease transmission, and fewer deaths. This is a good thing for the City of Richmond and the people of Richmond.
The motion will be brought forward at a General Purposes Committee on Monday, February 5th, then to Council. A motion Councillor Heed hopes will be approved unanimously for a site he says will be part of a continuum of care for what is a very complex public health issue. In Richmond, Kate Walker, City News.